Okay, thank you, Robin. This is me live. Thank you to the One Health Poultry Hub for the opportunity to give this presentation. As the subject of today's meeting is vaccination, what I'd like to do is just to discuss some of the special considerations when developing a new vaccine for poultry. I'll talk about some of the key points for developing a veterinary vaccine, and I'll talk about the importance of innovation within poultry vaccination. Next slide, please. So what are the special considerations for poultry vaccines? And in particular, I'm thinking about those for chickens. Well, first and foremost, you need to consider the cost of the final product. This is a very price sensitive market and the cost of the vaccine needs to reflect that. Therefore, some of the technologies available to you may not be applicable when developing a vaccine for poultry. The vaccine, of course, should prevent any mortality or morbidity within the birds, but it's important also to look at the productivity of those birds, and that's often what customers require from a vaccine. So you should need to look at egg production or meat increase in terms of FCR when measuring the efficacy of a vaccine. The vaccine needs to be convenient for the customers to administer, so there's a good uptake of the vaccine. And of course, for poultry, generally, you require some method of mass administration. And that can be via on-feed, in water, via hatchery spray, or just simply an in ovo immunization. The vaccine should ideally be a single dose vaccine. It should provide a rapid onset of immunity, and generally that means immunity developing within 7 to 14 days. And it also should provide a long duration of immunity, and that would hopefully be for the lifetime of a broiler bird. The vaccine also needs to consider strain variations of a particular pathogen, and it should aim to provide as broader protection as possible. And it needs to be stable, particularly when held within a reliable cold chain. And last and not least, it needs to target the particular sector of birds for which it's being developed, be it for broiler birds, for layer birds, or for breeder birds. Next slide, please. So let me just talk a little bit about the vaccine development process itself. This is generally split into two stages, a research stage and a development stage. The research stage can take up to 5 years or more to complete and is split between discovery and feasibility or pre-development. During discovery, you generally investigate the pathogen and the immune response to that pathogen, and you'd come up with an immunogenic formulation that might look suitable as a vaccine. During feasibility and pre-development, you would take that prototype vaccine and run proof of concept studies in target species to show that the vaccine is safe and efficacious, and you develop an outline manufacturing process. Once you have this information in place, you're then ready to go into full development. The development process for a European type vaccine generally takes 3 to 6 years to complete, and it's split between early phase development, late phase development, and registration. During early phase development, you run laboratory safety and efficacy studies to show that the vaccine is fit for purpose. And during later stage development, you would use GMP manufactured material to run field trials to show that the vaccine works under field conditions and is entirely safe. And lastly, you would then take all the data to prepare a dossier that would cover the quality or manufacturing process, the safety, and the efficacy of the final vaccine. And that registration typically can take up to a year or more to complete. Next slide, please. So if you look at this particular website, vaccinedevelopment.org.uk, you will find there some maps of the development process for both human vaccines and for veterinary vaccines. And I published a guide in Vaccine last year to cover the vaccine development process. Next slide, please. So there are some key points to bear in mind when you're developing a new vaccine. Well, first and foremost, you need to develop a product profile. This is sometimes called an SPC, or summary of product characteristics. And this would provide a description of the product and its desired safety and efficacy data. Once you have this product profile in place, you can then develop a project plan to cover the vaccine development process with all the associated timelines. Throughout the product development process, you must keep diligent records of everything you do so that those can be used in the licensing of the product. And it's particularly important to source all materials from safe sources so that they are free from any extraneous agents or TSEs. You should lay down a pre-master seed and a master seed of known and tested quality early on in the process, and you should develop an outline manufacturing process for the vaccine. And you should be using material derived from that master seed and using that outline manufacturing process in any regulatory studies so that they are fit for registration. You need to run studies in the target birds. Often early laboratory studies are run in SPF or specific pathogen-free birds, but you must run studies also in either the broiler, the layer or breeder birds for which the vaccine is intended. And you also need to run the administration route for which the vaccine is to be registered. And if there's more than one route of administration, then you need to run safety and efficacy studies by each of those routes. It's wise to have a regular interaction with the regulators, and in doing so, you should have an early interaction if possible, and that will greatly facilitate the licensing process going forward. And last but not least, you need to bear in mind the end user, customer or farmer who's going to use the vaccine and make sure it's fit for purpose for their use. Next slide, please. So innovation is particularly important within poultry. You should bear in mind that recombinant technologies have been used in vaccines, although most poultry vaccines licensed today still rely on traditional live attenuated strategies or killed inactivated strategies. Having said this, there are a number of recombinant technologies, and of these, the vector vaccines are particularly important. Viral vector vaccines are now commonly used using a range of different viral vectors. And one good example of this is the TRT vector, which is used to deliver other antigens and recently has been licensed for the delivery of both IBD and ND. So by administering one dose of this particular vaccine, you can get protection against 3 pathogens: Marek's disease, infectious bursal disease, and Newcastle disease. And there are other further viral vectors in development to carry other antigens. Bacterial vectors are also being studied, and these tend to use live, safely attenuated bacterial carrier vectors to deliver other antigens. And there has recently been licensed a vaccine which carries antigens from Clostridium perfringens type A, and that provides dual protection against both Salmonella and necrotic enteritis within the birds. And lastly, there are vaccine vectors nowadays being studied from Apicomplexa, particularly the Eimeria species that cause coccidiosis in birds. So by taking attenuated strains of Eimeria that are used in vaccinations, people have actually used these to carry other Eimeria antigens to broaden the cross-species protection with those Eimeria, and to carry antigens from either viruses, bacteria, or parasites to provide protection against both Eimeria and those additional antigens. Mass delivery, as I said, was very important, and there are a number of innovations used for in-water, in-feed, hatchery spray, and in ovo administration of the vaccines. And there are a range of novel formulations used within the vaccines industry. I've got a picture here of some Spherions, which are freeze-dried vaccines, and temperature stability is something that's particularly important and studied in terms of stabilizing formulations. Next slide, please. So just to summarize, there are a number of important things to consider when developing vaccine for poultry. New vaccine development requires careful preparation, planning, and execution. And poultry vaccines often rely on innovation for improved safety, efficacy, delivery, convenience, stability, and cost. Next slide, please. Thank you for your attention.